Good afternoon. I'm Cara O'Sullivan, Associate Director for Evaluation of the Innovations in American Government Awards Program here at the Ash Center at Harvard's Kennedy School of Government. Thanks to everyone for joining us for today's webinar, The Power of Networks and Technology in Human Services Case Management. We have quite a distinguished panel of presenters today, beginning with our moderator. Julie Boatright Wilson is the Harry Kahn Senior Lecturer in Social Policy, as well as the Director of the Malcolm Wiener Center for Social Policy here at Harvard University's John F. Kennedy School of Government. Wilson's work focuses on poverty policy, family policy, and research design and methods. For many years, she's taught a course on strategies for strengthening families and protecting children, which focuses on juvenile justice and child welfare issues and programs. Among Wilson's recent projects are studies of adoption from public agencies, state agency reform, and community-based strategies for strengthening families' capacity to parent. She's also working with several colleagues on strategies for generating evidence on effective interventions. Wilson is a sociologist by training, and we are honored to have her serve as the moderator for today's webinar. Julie.
Thank you. It's my privilege to introduce three very exciting speakers. I believe their bios are available to you, so I'm not going to read them to you, just give you enough of an introduction in the order in which they'll be speaking. The first speaker will be Maurice Miller, who is the founder and CEO of the Family Independence Initiative. This is a national center for anti-poverty innovation that has a philosophy that says with enough supports and resources, people who are poor can really do for themselves and would be much better off working with their peers, their networks, and moving forward than to have others do a lot for them. And he's going to be talking to us about what he's learned and about what the innovations are that they've been developing originally in California and now moving out into other states. Maurice will be followed by Bruce Kamradt, who is the Administrator of Children's Mental Health Services for Milwaukee County in Wisconsin, and is the Director of Wraparound Milwaukee, which is a system of care for children in the child welfare, juvenile justice, and mental health area that have serious mental health needs. It's a remarkably innovative program that he's going to be describing to us later. And third will be Kathleen Feely, who is the Vice President for Innovation at the Annie E. Casey Foundation and Chief Executive Officer of Case Commons. Kathleen has a very distinguished career in local government, in foundations where she's worked with both state and local government, and has been with Casey for a long enough time to have helped Casey develop many of its major initiatives, the Strategic Consulting Group, the Family to Family Initiative, the Juvenile Detention Alternative Initiative, and now Casey's new automated knowledge management system, which she's going to explain today. So Maurice, let's start with you.
Okay, thank you very much, Julie, and welcome to everybody. I did glance at the list of people that had signed up, and it's a huge diversity of interest and expertise. It kind of reflects the diversity and the chaotic nature of the problem that we face, which is helping people. And humanity is just very diverse. It's ever-changing. It's contextual. It's chaotic. People and humanity is really amazing. It's hard to look at humanity from the outside, and especially if we try to do it through our own lens and our own expertise and our own interests. And I think we all kind of know that from the inside, everybody, if you look from the inside out, every family probably looks at themselves in a very different way. What they do is influenced by their traditions, their culture, their values. And it's kind of common sense, and research kind of tells us that people leading their own change, owning their own solutions, really can have the most impact. And for a lot of us, it really is, well, are the people in good enough shape that they can lead their own change? FI actually was set up to try to recreate the conditions under which people really could lead their own change, supported primarily by their families and friends. And social networks and technology, which is what this webinar is about, are really two key levers, but from our perspective in terms of our lessons, it's certainly not the only two, although they're very powerful. I'm going to take you to the next slide. FI started because of a discussion I had with who was then Mayor Jerry Brown, and now he's our governor here in California. And what he did in a phone call with me is he was very critical of our sector. This has been after 30 years of the war on poverty, that he thought that we were primarily creating jobs for ourselves. And so the discussion kind of led to, well, you know, can families really help themselves, and to what extent can they? And FI was really set up to test that premise. Could people really take the initiative, help themselves, and could they help others? And what was the role of professionals? And one of the things that we did is I'd been already studying social networks, and I had a data tracking system. And I felt that for us it was going to be really important to have the role of professionals be really minimized so that we could actually see the capacity of families. On the slide, if you look at the families that we've been working with are generally around the poverty line. In the latest families that we're working with, 40% are under the poverty line. The rest of the families are above poverty line, but still they cluster on an average income of about $26,000 for a family of 4. They have people in the family working, et cetera, et cetera. There are single moms that show up within our system, because our system really incentivizes people to show us how everybody survives and the interconnectedness within both family and their friends. These are the same families that I served when I ran social services. I ran a large community development corporation. It was the same families. When you see the kind of impact and progress that the families make, everybody thinks that we've creamed, because nobody believes families can do what they actually can do. But the fact is, these are really the same families that we normally see show up. These are not the families in crisis. I think Bruce is going to talk to some of the kids and other families that really are in crisis. If you look kind of towards the left-hand side, total left-hand side, somebody could be totally homeless, have mental health problems, et cetera. We're not engaging that population. We do think that safety net was really set up to try to take care of those who measure need, et cetera. The way our system is set up, if you look at the overall slide, is that we actually have systems to try to help people that fall into crisis, and that the heavier the crisis, the more resources that there are available. The other thing is a study done by the Corporation for Enterprise Development showed that we have incentive systems for people that have money. And again, it tends to focus more towards the right. So the the line on the right-hand side is really from a study from the Corporation for Enterprise Development that indicated that the government really puts out about $367 billion, mostly going to the very high-income folks. In between, you kind of see that there isn't very much. There really aren't very many things that can help working poor and lower middle class. And I thought what was really interesting that really ties into our work was Governor Brown, he was complaining about the fact that even though it seemed like we were helping people, that for some reason we weren't breaking the cycle of poverty. And a study that came out in 2008 by the Census Bureau indicated that in the 3-year period that they studied, more than 97% of the people below the poverty line moved above the poverty line. And that's that green line that flicks up to the right on the top, the green line. But in that same study, they noted that within 3 years, 30% fell right back under the poverty line. And so what we ended up realizing is that the population, even if they become working poor and above the poverty line, they're very vulnerable. And this is where you get where some kids get in trouble out of the families. Some of the other kids in my family, I'm the one that made it. My sister really ended up in trouble and ended up in crisis often. Same thing with her family, that it wasn't the entire family fell into crisis, but what happens is we have working families that don't have the resources to be able to take care of all of their kids, and it just keeps cycling back and forth. And a lot of money, after a 40-year war on poverty, a lot of money has been spent. We certainly have helped people, but we have not broken the cycle of poverty, and that was really what we were supposed to explore. So the discussion with Jerry Brown was, okay, so what happens if we pull the professionals out and we trust the families to figure it out? That every family won't be able to figure it out, but what we knew is that within social networks, different patterns could be established. Different people would step up to take advantage or take initiative or come up with things that work for them. And that, again, the power of social networks, natural social networks, not the ones we form, but the power of natural social networks with friends and whatever, is that you watch each other, you're part of each other's lives. And when one of your friends starts succeeding, then it starts changing how you think about what could really happen. And that what we expected is that if we took a number of different families and we let them move forward, that we would see different people taking different roles. and that out of that, whatever progress they made would really be within a context that was culturally appropriate for them. In this slide, what I was trying to point out is that the system that we have now was really set up really as a safety net for people falling into crisis. It certainly wasn't set up as a springboard to really help people become independent, and that's one of the dilemmas is we don't really have a strong system for helping people and recognizing their initiative and the strengths that they might have in their life. And so, again, what research has happened and our studies have really shown is that self-determination really is the thing that has moved people more. When you own the solution and it's yours, not only do you succeed, but it starts changing the normative behavior within your circle of friends. In the situation where we have case managers, if it isn't someone in crisis, then what can happen is that the relationship can stay between the professional and the family, and the other families around think that whatever progress is being made was really because of the professional, as opposed to your friend. And so for us, a lot of it was trying to basically tell our staff, if you give any direction and you try to case manage or counsel, you will be fired. And people were let go that just, on our staff, that just couldn't help but be helpful. The other thing is that we have a perverse system of incentives. Right now, if you start making progress under many of our programs, you either lose eligibility or you actually lose benefits. And what we don't have, which I think people that are better, our middle and upper income have, we don't have actually system of benefits that rewards and incents and recognizes people making progress. Again, if you don't have that, you start changing the normative behavior within a lot of communities that are vulnerable, because they start feeling like, well, really, the only way I can get access to resources is if I get in trouble, because I could see that my child that got in trouble then had eligibility for scholarships and had counselors and had access to the different things, but my kid that didn't get in trouble did not have all that. So this issue of really rewarding progress and making sure that people stay eligible is really crucial. It's not to take away the safety net, but it's to make sure that it actually, in the longer term, sets up a different set of behaviors. The social network piece is also huge. When we pulled out our professionals and case managers, because I used to have a lot of case managers and social workers in my previous job, people still need other people. And what ends up happening is that one of the biggest changes when we ask for feedback as to how come people have done so well, one of the biggest changes is they start seeing their social networks as both emotional support, as people that you could push, as kind of just rebuilding the sense of community that you're kind of together. But when you start moving forward, you start moving forward together also. Often when we introduce a lot of volunteers from the outside, when we have a lot of professionals come in, it tends to also break down the sense of community, of relying on one another. In history, it's like when people were really discriminated against, they really had to turn to one another. And then you saw, townships develop after slavery. You saw the Irish, the Polish, et cetera, that a lot happened because they relied on one another. We want to make sure that we don't create an environment that really tells people that, no, relying on one another is not the primary thing that gets resourced. It's really you need to wait for other professionals to come in. So, again, it's not that the existing system is bad, but it is harmful if there isn't another system that incents the other type of normative behavior, which is taking initiative and helping one another. The other thing is that it became really clear to us that in our studies was that the issue of being respected and trusted as experts about your own family and your own community was huge. We try to come up with institutional generic solutions. We have a fragmented system of delivery. None of those are necessarily culturally based or based on friendship, et cetera. It is not a consumer-driven type of system. For middle and upper income, we have all the same problems. Our kids get in trouble. Our teenagers may need Thunder Road, which is a service, or Sylvan Learning Center. Somebody may get on drugs. You have to go to Betty Ford Center. Services are still needed, and the way that safety net works, though, is that because we have money, we purchase or don't purchase the service in the timing that we want. Services for the middle and upper income are really consumer-driven, but that's not the case with families that are low income. They don't have a wide sense of choice, and their feedback is really only included sometimes in focus groups, but it is not what determines their funding. And we're going to talk a little bit more about that when I get to the technology piece. I'm not going to go a lot through our structure in the question and answer. You may want to ask me more questions about it. We essentially enroll families. We don't cherry pick. We enroll them when they bring a whole bunch of their friends together, 5, 6, 7, or 8 households together that have known each other, talk with each other. We'll enroll them as a group. We'll challenge them to change their own lives, not with a case manager. Every household gets a computer so they can report progress to us, so they can see their own progress, and they can share information. So the technology piece helps a lot. We do meet with them monthly to get a picture of why the data is changing the way it is. The families have to enter monthly. They have to go through audits of the information, and we pay them for their time. It's the equivalent of about $25 to $30 an hour for the amount of time they spend getting us stories and data and being audited. And what we see is natural leaders emerge. So when we have done this, and now it's been over 10 years, and now it's 4 cities, what we realize is that the core families that we initially worked with made tremendous progress, and that it started having a ripple effect on other families that were part of their broader community. We opened up nominations where the core families in San Francisco could bring in other families that they nominated in their social networks, and within 6 months we had 200 families clamoring at our door. It's continued to climb. It was all word of mouth, although I think now we can use technology to really spread this much more. On the outcomes piece, consistently, household incomes have jumped, kids' grades have gone up, lives and all these outcomes are intermingled. You can't say one is cause and effect of the other. It isn't necessarily that somebody's income then led to their kids' grades going up. Sometimes it's because the kid was doing better in school, that the parent was able to go out and look for a job, et cetera, et cetera. Again, every family has to approach it differently in their own context, but we've gotten consistent results that debt goes down, savings go up, kids do better, health outcomes, et cetera. And at the end, you'll see some of the data that we collect. On the technology piece, it became one of the biggest drivers, I think, that what normally happens is that in our sector, we talk with one another. We do it at webinars. We do it at conferences. Sometimes we bring in families who are the consumers into focus groups. But like I said, the consumer isn't what really drives our process. We are generally driven by conversations we have, like this webinar, studies that we've seen and that we share with one another, research that's been done on the families. Then we form programs, and then we try to administer them. What FI try to do is kind of flip that, so that the first thing would happen is that families would be inputting data on a monthly basis on what's changing in their life. They would share it both with their group, and then they'd be able to see it themselves. And in that process, which is in the middle here, that feedback system, somebody mentioned it was kind of like when families can see their progress, it's like keeping a food log, and if you see what you're eating every month, you do better. Certainly there's a lot of places, businesses run on feedback on profit and loss sheets, et cetera, et cetera. So that was really one of the biggest movers, is people being able to get data. Data is important for everybody. It's particularly important for families, and our sector doesn't tend to share that data. The other thing is that we've been doing is that we then take that information and how the families are reacting, and we look at them as consumers, and then we're talking to funders and policymakers in terms of what adjustments really need to be made, and can they be more responsive to the consumer, and also to service organizations. We have a kind of a Yelp. And so a family that tells us that they went to a child care program or an after-school program, they will then rate it, and they'll tell us and they'll give us comments, not necessarily just for us. What we found is they want to talk with one another. It's like, don't go to that child care center. Something's really wrong for our kids or something like that. That's the kind of thing you and I will really do. So the data system has been, really one of the biggest change agents for us. And this last slide, because I'm going to be finishing, gives you a sense as to the kind of data. We don't try to have the payments dictate a particular type of action. What we do is we spread them in a way that families are forced to report all the different things that happen in their life, and the amounts are so small that they don't incent a particular behavior, but instead make sure that the families will report it. So I'm going to close with that, and then when we get to the question and answer, we can follow up.
Thank you, Maurice. Bruce.
Thanks much. Thanks much. As I begin to talk about Wraparound Milwaukee, I'm going to do it in a talk very specifically about our program here and how we employ the both technology, information technology, and what we'd say the power provider networks in building our very innovative model here in Milwaukee. A lot of what Maurice was talking about, though, resonates very strongly with us as we talk about trusting families, parent choice, parental independence. They're all really important values to us. First of all, to talk a little bit about this subject and doing it in a specific, very specific to our community and to our program, we have to give you a little bit of background about Wraparound Milwaukee. Wraparound Milwaukee is what we call a unique system of care, and it was designed for children with serious emotional and mental health needs who were at risk of or who were going into institutional placements. We had far too many when we launched Wraparound Milwaukee in the mid-90s. Unique, we created what probably in the U.S. was the first publicly operated what we call care management organization operated by Milwaukee County Mental Health to be one single system of care that would pool funding from Medicaid, child welfare, probation, education, and become the single entity to plan, deliver, and pay for services and supports for those children with serious emotional and mental health needs and their families. A very unique approach. Rather than each individual system trying to take care of their own kids, the power was actually in pulling it all together to have one single system involved in planning and delivering those services. So each family had their own plan, their own single care coordinator. So one plan, one family. Currently, Wraparound now serves over 1,500 children and families annually, and we've dramatically reduced the use of residential treatment placements from 400 average per day to under 100. We've reduced psychiatric inpatient care from 5,000 days to 500 days, correctional placements for kids with serious emotional and mental health needs, so much so that they've closed 2 of the 3 juvenile correctional facilities that will close July 1. And as we're aware, we're the 2009 winner of the Harvard University Best Innovation in American Government Award, which we're very happy and pleased that Harvard recognized us. Now, there are some innovations that have made Wraparound a national model, and when we presented at Harvard 2 years ago, each of these were kind of emphasized as innovative practices, and 2 of the 8 that I'm going to talk about in more detail are today's topics for today's webinar, and that's the power of networks and information technology. But let me go through our list. One is strength-based, highly individualized care, very family-focused, and for us that's very important and a very important value that drives our system. 2, collaboration across child-serving systems, which I mentioned a little bit about already, which is the power is when you bring all the systems together, pooling the resources, number 3, so that there's sufficient funding, so there's better coordination, so that we bring down those silos of funding that really impede our delivering services that really individualize to the needs of our children and families. A 4th innovation is our care coordination and child and family teams, which we hear family conferencing. There's different approaches, but we call it the wraparound approach, and we call these child and family teams because the families drive the system of care. They drive their own plans. They develop their own care plans. Professionals sit at the table with the families, but the families are the ones that drive the planning. 5th on this list is the use of mobile crisis teams 24/7, which we now do for the public school system. We now do for the child welfare. So it's been quite an expansive, but we we have multiple teams all over the county. The last one here is emphasizing quality management. And then the two that I want to talk about are what we call our comprehensive service array, or the idea of a provider network. And secondly is information in the development of our own information technology system, which has been really critical to Wraparound Milwaukee. The power of the provider network. By pooling funds, Wraparound Milwaukee was able to create a very comprehensive array of different services. When we're talking about children with serious emotional mental health needs, one size does not fit all. What is extraordinarily important, and what we've learned, is the importance of, if you're dealing with 900 children a day like we are, there need to be 900. There are 900 very different and unique personalities and families, and we need to be able to develop plans, and we need to be able to put services in place that can truly individualize and meet the needs of that unique child and their family. So we put together, rather than a single or 2 or 3 or 4 services, a very comprehensive array of different services. There's 70 different services in our benefit plan, which is kind of unheard of from an entity that many would look at as a type of managed care system. And if it doesn't exist and a child needs it, we simply create it. To deliver those services, what we did basically is we stopped contracting for most services on what we call contracting, fixed contracting, expense-based contracting. What we did instead was we developed a network of over 200 agencies in Milwaukee County to all be part of a single network. And I'll talk about information technology, all linked even on one information system. But developed a network of providers. And rather than expense-based contracting, in our network, providers are paid on a fee-for-service basis. Each provider, we set a rate, and we basically provide and pay for those. We basically pay for those services on a fee-for-service basis. Wraparound Milwaukee then becomes a single payer for all services across all child-serving systems. So rather than child welfare paying for some things for the child, juvenile justice, education, we use Wraparound Milwaukee, who's getting all the dollars and pooling them so that there's simply a single payer for all the care. And families know who that payer is, and one system becomes accountable and responsible. So it's a much more, we found, efficient way of doing it. The benefits of going to this network and to go to this array of services is that you can truly individualize care so that every child and family's unique needs can be met, because you have a range. You have an array of services, and you have an array of different providers. Families have their choice, which is very important. Maurice was talking about that. Families choose their own providers, who they want to provide care. It's there, and they have options because there's well over 200 agencies. So there may be 20 agencies that provide intensive therapy in the home. The families can choose who they want. Flexibility of the system, because funds truly follow the needs of the child. And if you put the old way of doing it is that every system siloed their funding, which made it very restrictive and very hard to access. We tore those silos down, and by putting all the funding together in a single network, we created the flexibility so that as needs change, funds can follow the needs, because they're not stuck in one contract for one specific service. So if people are identifying less residential care and more mentoring for their kids or more after-school programs, the funds can always follow their needs. One network can serve multiple child-serving systems. So we have 5 different programs within Wraparound, but one network serves all of them. One network even, we serve as the network for one of the managed care companies. We do all their behavioral health care. So one network can serve multiple child-serving systems. Another benefit is that costs go down as providers only get paid for the units of service. So there's no administrative costs in the usual sense. We pay for only delivered units of service that kids and families receive. By having a large network, competition is increased, which improves the quality and timeliness of services. We get very few providers that say, I can't provide that service, or I can't provide it for several weeks, because they're in competition with other providers, and quality and cost really, and responsiveness will really move that forward. That's who will get the business. It's very good at level the playing field for new providers. Almost 50% of our provider agencies are minority owned and operated. Many new agencies developed because we could level the playing field. Rather than a few agencies, large agencies, being able to bid on and get the contracts, by going to a single rate, unit rate for everything, paying fee for service, it really brought in more minority agencies and providers into the network, particularly neighborhood-based. And it also is an ability, gives us the ability to redirect institutional monies and expand service, which, as a job creation strategy, we created hundreds of new jobs in the Milwaukee area for various providers, not only mental health providers, but mentors, tutors, job coaches, after-school programs, art programs. So it's a very interesting strategy in more ways than people usually think of when they don't think of it as job creation, when you're moving money that's largely going outside of Milwaukee to institutional providers and moving it back into the community. Now, all of this couldn't be possible unless you have a good information technology system. So the power of information technology is huge. What we basically did is create our own IT system, our own information technology system. Rather than buying something off the shelf and trying to modify it, we brought our consumers, our families, our care coordinators, kids together, and over a period of time in 1999 and 2000, basically sat down and really developed an information system that would be consumer-friendly, and would provide the information that we really needed to capture. So we basically developed our own system, which we now call Synthesis, which manages all the information in wraparound. We needed an internet-based software system because we contract with 8 care coordination agencies and are over 200 providers. We didn't want 200 individual IT systems. We needed one single system, information system that would link all of our providers, all of our care coordinators, all together, and our stakeholders such as child welfare, probation, and education to some extent, so that we could share information more readily. And the Internet is really the only way that you can really easily do that. But a very secured, very HIPAA compliant, and which is the final point, system needed to be designed to be consumer friendly and also HIPAA compliant because it serves as our electronic medical record. So today what we have is, what we've developed is within our IT system is we focused on integrating several areas and needs. But our enrollments, all the demographic information about our children and families goes into the system. We automate the plan of care and all the progress notes. So for a care manager, it's very efficient, and they can do their plan of care. Their treatment plan is done online. They can do it in the family's home. All the progress notes are automated and done online. Service authorizations, providers get since they're all on one system, they get their automated service. They get their authorizations right online in terms of providing services, which they can do right at the child and family team meeting or right after the meeting. Everything is electronic in terms of invoicing and claims processing. There's providers bill. There's no paper billing system. It's all done electronically as they enter their invoices, and then Synthesis we do the claim processing through the automated system. All provider credentialing, so the ability to provide a service as a mental health professional. Do you have a license? Do you have a background check? Do you have any adverse findings? All of that goes into, all the provider credentialing is done online, all the tracking of outcomes, so child behavior checklist scores, educational data, whatever the outcome you're tracking, we track those outcomes online. Quality management and utilization review, all of the quality management tracking, and all basically is done through this automated system. So what Synthesis has enabled us to do really is to go to a paperless system for all of our management needs. Care coordinators, who are our case managers, can work much more efficiently and effectively since they can enter and track the data anywhere. And the care coordinators today, a much younger group, are very savvy, computer savvy. So this is what they're used to doing, and for them it's much more efficient. Providers, because they get their authorizations online, the invoicing is done online, claims processing is automated check writing. Providers get paid within 5 to 6 days of their submission of their invoice or bill. So what that has done is it's encouraged provider participation in Wraparound Milwaukee. And as we've expanded now, our probation department is now gone on to our Synthesis system. Our adult services, community services is potentially moving on to Synthesis. And we found a new revenue stream as Synthesis now has been utilized by other communities, and we have recently sold it to Cuyahoga County, Cleveland, McHenry County in Illinois, and most recently to the state of Georgia for their system of care program. So it's expanded and it's been huge in our program. So that's how we look at the power of technology and of a network. So I'll stop there and wait for questions later.
Thank you, Bruce. Kathleen.
I'm sorry, here I am. I was on mute. I hope that my remarks build on what Bruce and Maurice have already presented, because I think a lot of the policy underpinnings that they are implementing in their programs are policies that the Casey Foundation has worked hard to support over the last 20 years. And my particular role has been working in public human services and trying to reform the systems, the child welfare, juvenile justice, and broader human services systems that often support the kinds of systems of care. Lots of times, as Bruce said, they contract with state or counties to get the funds to run the systems of care. And so we've been working to really change those systems to fund more programs like Wraparound and like Maurice's programs, and spend less money on high-end care, residential or incarceration, et cetera. And over the last 10 years, or first let me back up and say that Casey Foundation, as you might know, is a big promoter of making policy decisions based on data, not on what it used to be when I was young, which was anecdote or real hard research, one or the other, and more often I think anecdote. But we have promoted the use of using data to make better policy decisions and better decisions about what to do with particular families who are in crisis or who are using public human services systems. And about 10 years ago, I started a group at the Foundation called the Casey Strategic Consulting Group, which was modeled after private sector consulting, in that we worked with states to gather data and help them analyze it, and so that they could understand more about their child welfare or juvenile justice system. And what we found was that the state administrative data systems were, it took about 3 months at least, 3 to 6 months, and about $300,000 to clean the data and put it into analytical files so that our staff could work with the state staff to analyze it and understand what was going on. So these are huge data sets, and so I want to distinguish it from programmatic data for a minute, because I want you to start thinking really big, like the whole child welfare system in the state or the whole juvenile justice system in the state. And what I was like stunned, despite the fact that I had been working in public sector for so long, I was really surprised that it was that difficult to analyze the data. And I think before Casey had always contracted out that part of it, and this time we were doing it ourselves. So we gave a grant to the Stewards of Change, which is a group working in mostly child welfare, and they were using sort of analytical approaches to improving child welfare. And we asked them to go around the country and look at the state-administered child welfare information systems, or SACWA systems, which are in almost every state. It's the system of record for child welfare, and tell us which one was the best. And they came back and said, although there's really great people out there, there's no really good systems. There's a lot of people who are doing really interesting things and who want to do more interesting things with technology, but the system is not set up from the federal government on down to really incentivize that kind of innovation. And so we did what foundations do. We funded a conference and had several conferences at Yale where we brought together people from state government, federal government, some academic people, children's research centers, and tried to figure out what to do. And I like to think that two things came out of those meetings. One thing, they're still going on every year, but one thing is something called interoperability that the federal government is working on, trying to get the silos of data to talk to each other at the federal and then at the state level, and Casebook. And so I'm going to talk about Casebook today because that's what we've been working on pretty specifically. On my way up to one of those conferences from Baltimore, I stopped to see my daughter, who was at that time a student at New York University, and for the first time I saw her Facebook page, and this was in 2006, I believe, and she, as soon as she showed it to me, which was only to show me the pictures from her birthday party, I was blown away by it, and I right away in my head translated what I was seeing into, oh, this would be so helpful for social workers. So I sat there and asked her things like, could you friend your advisor at school? And she was like, yeah, Mom, but why would I want to? Could you friend your pediatrician? Could you friend anybody who could help you in your life? And she was like, she got where I was going with it. And we sat there and talked about it during this very rainy afternoon. And so that was the beginning of my quest. I actually knew very little about technology, and I didn't really have the vocabulary to explain my idea, and had to let her log in and show other people what I was talking about. Like, if this were a social worker and that were, you could friend them, and you could talk across agencies, and you could talk to people outside the agencies, et cetera, et cetera. And over the next, we tried to get Facebook to build this for us. We tried to get Google to build it for us. And finally, after about a year of learning vocabulary and trying to understand new concepts, we found an entrepreneur in New York City who understood what we were talking about and said, we can do this. And that was the beginning of building Casebook. We tried to build it at first for a public system and decided that we would pull back and build it first for our own Casey Family Services, which operates in 7 states and operates both family strengthening services and foster care services. And so I'm going to show you the beginning of what it looks like. And we picked child welfare in the beginning, because child welfare involves a lot of the country's most vulnerable children and families, and the data systems were particularly difficult to deal with in these states when we were working with in the consulting group. And the second thing is that the data often needs to be available to people on a more real-time basis. We hear all kinds of stories about decisions getting made that would have been different if the person in the field had real up-to-date information, or if her supervisor had real up-to-date information. So we worked with Casey Family Services over the course of about a year, and we built a system that is, as you can see on the right-hand side of the page, it looks different, it acts different, and it has the qualities and features that any kid coming out of school, out of social work school or undergraduate school, knows how to use this practically without any training. And if you look on the right-hand side of the screen, you'll see that we organize the data around families. Everything in the system is family-centric, and helps workers remember that we're talking about not just the children, but their whole family. And on the left-hand side of the page, we have the tasks that people do, what you've been working on, and then your activity feed. The activity feed includes information that comes in from other agencies that have been given permission to provide information about a case. And so a case team can be cross-agency, and this activity feed can be a note that's sent in, and it just summarizes the note in this activity feed. And so our workers have found that to be really a useful feature for everything. So we have also developed things that are automated case plans, so that collaboration can happen on a case plan, a service plan, whatever it's called in different agencies. People can participate remotely. If you put it up on a screen like we're doing today, you could work on it. It sort of could be a virtual, I hate to say virtual family team meeting, because you'd obviously want the family and the primary people involved in the case in a room with people. But there are people in family team meetings who have relatively small roles in the case who we ask to be there. They could be there remotely, and it would enable us to do more family team meetings more easily, as scheduling is really a problem. On this page, I just want to show you, this is the timeline. I want to point out the timeline at the top of the page. And the timeline shows everything that's happening in a case from the very beginning to the very end of the case. And so this is something that in state-administered child welfare information systems, this is very hard to get. In Indiana, where we're working now, a case requires 800 screens from beginning to end to be filled out, and depending, on the case. But you'd have to, they're designed very linearly, and people have to go through and either remember which screen something's on, or scroll through and get to it. With the timeline, you can see the entire case, and you could click on any one of those buttons, and it will give you a little bit about the note that it's related to. So you can see when the child went to a doctor, when the school started, when the child's placement was, and it goes across years. So it's like a case in a very concise and easy to view feature. So we are building that, as I said, right now for Indiana. It's in use in the 8 divisions of Casey Family Services, and we have a contract with the state of Indiana to build it for their entire child welfare system, and we're in the middle, about right in the middle of that build. And so I was just going to show you a little bit, some of the things that we think that we've improved on in Casey Family Services, the people and family are, you have to scroll down a long time to get everybody that's involved in the case, including the people from other agencies. It could be a substance abuse program, the school guidance counselor, it could be somebody from therapeutic daycare, you know, the variety of people who might be involved in a child welfare case. In version 2, we've come up with a network, a family network, where we can show the person, and the children are always, you're always surrounded by their parents, their biological parents, until there's a termination of parental rights, if that's going to happen in the case. And we've arrayed the person. You don't have it on this page, but the network is arrayed with small photographs, if we can get them. Children have to be photographed. Parents don't always have to be photographed, depending on the state. But we try to get as many as we can, so that we're always reinforcing that these are real people, and you can distinguish among the people, so that, and reminding people to think of people in the context of their family, and the family in the context of their community. So we think that we've got here a very rich family-centric case history that we're building, and we have access because of it's also Web 2.0 based, it's internet based, it's not internet at the front end, it's Web 2.0 all the way through, which means that the data is exchanged in real time on virtually every data element in the system. So it's constantly being updated, just like any shopping site, or in fact we're using something akin to a shopping cart feature in one of the, when people go to get services for a family. So we're not going to call it a shopping cart, of course, but it's that same idea that you'd put together an array of services with the family so that it's really easy to understand. We've actually tried to take a lot of things that are very intuitive and that are in common use in commerce and entertainment, and put them to use in our applications so that it's really intuitive for new workers. We all know that we're facing a drop-off as the baby boomers retire, and I think the Casey family, and probably everybody on this call, is really worried about how are we going to get the best and the brightest into nonprofit and government work, and I think this is particularly true if we don't get with the technology. So I want to just move from that. As we developed Casebook and we understood the power, more and more about the power of technology, we really understood that this technology, if you take it to its logical conclusion, it's an application that we think can not only transform child welfare, but it's an example of a new approach that can really have a much broader impact on child and family well-being. So we all know that our, as you can see on this slide, our services are now organized into silos. And if they're going to be integrated, it happens at the program level. And what we're thinking about is that what if we each one of these silos has family demographics. Each one of them has business rules that control privacy and access to that system. Each one of them has a rules engine, and each one has users. So Uma Uluwalia in Montgomery County, I don't know if she's on the call today, but she had a homeless family she's the director of social services in Montgomery County, Maryland, and she had a family that needed all kinds of services. They were homeless and they needed all kinds of social services tracked in Montgomery County, and they had to give their demographic information 21 times to public and publicly funded agencies. And we know that took at least 21 hours of publicly funded workers' time to get and input all the information that they needed, and probably 100 hours at least of that family's time to go around to different agencies and give their information. So what we're thinking is a lot of the information is the same, and a lot of what we're looking for is the same across agencies. We want families to be self-sufficient. We want families to be able to select among a variety of services. We want to empower them, but we don't intentionally, but we have made it very difficult for them because each of these agencies is driven by different rules, and the IT has different cost allocations, and it's a very complicated system. So we know that, and we know that we have to work within that system. However, we began to ask about what if we flipped this whole thing, and if you look at the next slide, what if we put all that demographic data about families into a data repository that actually could exchange data with anyone who is certified, who had the permission to get the data, so that we're building out the first piece of that with child welfare. It's a hosted service. It's hosted in the cloud, but I say that it's in a private and very secure cloud, and it's government. It meets all the government requirements for security. But what if we had, what if juvenile justice systems in that state were able to exchange information, demographic information, with that repository? And what if TANF and food stamps were able to exchange information with that repository? Then the data that is there would be able to immediately populate if you set up the business rules and according to the privacy regulations, which can absolutely be done. And the same thing with mental health services. What if all of those the information would be available to each of the agencies without the family having to go through all that information over and over again? And I'm talking about this on a very large scale. So if you think about Facebook has 600 million people involved in Facebook. So we know that this is a scalable technology. We know it's scalable in commerce, in entertainment. We know it's scalable. What we're talking about is let's take that technology and apply it to government services, and therefore we can reduce redundant data and demographic information being put into all these different systems. And we think that it's possible that we could develop one service plan, just like Bruce was talking about in Milwaukee wraparound. We could do this at the agency level, at the county or state agency level. It's still a team of people. They're still talking about a family. They're still, and maybe we could even reduce the number of case managers a family has to deal with. So we're talking to. I know that this proposal is really complex, and I think that it took us a long time to build the IT infrastructure that we have now in human services in this country. So I think that it's going to take a while to get to this new technology. But I think that everything seems to be pointing in the direction of going that way. And we hope that our work in Indiana in the child welfare system will demonstrate that it will scale and it can serve people all over the state, at least in one agency. And maybe there are children in the child welfare system in Indiana who are also on probation who will be enrolled in the system. And this will be available to the private agencies who have children who are in publicly funded child welfare, even if they're in a private agency, as you know, in that foster home through a private agency. So it's larger than just the people who make the decisions. And so we think that that is what we're actually trying to do, and we're working, as I said, both at the state level. We've talked to HHS about the regulations. to try to see if we could change some of the incentives, because the financial incentives are not there for innovation, at least in child welfare. We know that Casebook is just one of the technologies that would be required to go in this, or that would help us go in this direction. But we are really trying to build this technology so that it can keep up with, it's very flexible and it's much easier to change than some of the fragile legacy systems. We're trying to build it so that it can keep up with the changes that we know are happening in technology and that need to happen in our government systems in order to keep up. So thank you very much, and I'll be happy to answer questions.
Thank you, Kathleen. Questions are beginning to come in. If you have questions, please send them in. Not surprisingly, a number of the questions deal with 2 levels or 3 levels of security, and so I'm going to put all 3 levels out there. I think the first 2 levels are, one, are families resistant to sharing this information, and what are the safeguards for families? And second, how do you manage to ensure that you are HIPAA certified, that people are only able to access what they're entitled to access? I'd like to do those 2 questions first, and then the third question is, we've heard a lot recently about hackers getting into bank files, corporate files. How do you prevent these systems from being hacked? But let's start with the first 2. Bruce, you spent a lot of time on HIPAA. Do you want to discuss that?
Well, we designed our system with using an expert related to HIPAA. But one of the ways we do it is you begin with your release of information, for instance. So, and this was something that Kathleen talked about too. So we begin this by we do a single release of information that the family or the legal guardian signs that has all of the identified entities on it. So you have mental health wraparound represented, child welfare, juvenile justice, education. We can add adult services. We add other entities on there as we need them. So one way you begin on a HIPAA side is to have the ability to release the information. Secondly is that we use a secured website. A little bit of what Kathleen, it's not that anyone can get into wraparound. It's, number one, it's password protected, and 2, it's set up on a need to know. Our technology is that we can set up different levels of who can see what information and who can do what with that information. So those are big things that basically HIPAA. People think that HIPAA is somehow is a restriction to electronic health records. Not at all. That's what HIPAA is really promoting, is electronic health records. So you just need to put you need to put some of the protections, in place. Some of them are very logical, and there's not as many barriers. I don't think we found as many barriers. We have service for our providers do sign us a business agreement with us related to the data use, and they have to have a business associate business agreement with us. So we've set up protections to be able to do that and to become what we call HIPAA, compliant. If anyone knows exactly what HIPAA compliant actually means, but we kind of get it with the protections that need to be in place. But it really begins with that release of information, so that you have it set up so that you can share the information across those systems. As Kathleen was saying, that's how you get, how we exchange with child welfare, juvenile justice, and education. Those are some of the key principal stakeholder agencies.
Have either of you found any resistance on the part of families to releasing this information?
We have a demonstration. Casebook is being used in a multi-agency demonstration in Brooklyn, and the family is only 150 families in this particular demonstration. But they're not having any trouble getting families to release their to sign confidentiality waivers for those systems. I just want to say that we also, at the very beginning, we talked to IBM quite extensively, and IBM, the vice president of IBM, who was helping us think about this, was saying that in some ways the cloud is actually much more secure than legacy systems, because the information is stored remotely, so that it's not on your hard drive, it's actually someplace else. And so you can, all the things that Bruce talked about, password protection, encrypted data, all of the HIPAA requirements, all the FERPA requirements, all the requirements that are built, that these systems mandate, you can build in. And so I think that it's all in that business rule. It's going to be complicated to do it across, in a public system, across a whole state, but it would save so much time and so much redundant work that I think it's worth doing. But that's my opinion.
Let me ask again about, have any families shown any resistance? On the one hand, this appears to be something that would save families a lot of time and a lot of hassle as well, but I think a lot of us can understand that people might be resistant to revealing information. Have you run into that at all?
We haven't really with families. They've been probably readily, they haven't had a big issue with it. If you think about what this can mean, for instance, to a family, take our, using our electronic record synthesis with our mobile crisis team, they can now access, they can be out on a call, they can access a family having a crisis. Their child is having a mental health crisis, an emotional crisis. They can access that child's health, their plan. They can access their crisis plan. They can see what's happened in the past, what strategies have worked, what resources are available. They can take a look at that as they go out. They can review that child's plan as they go out to that family's home. That is a huge help to the families because somebody's coming not blind. They already have information that can really be useful and helpful to those families. That's something families will never, that families don't object to because that's a help to them. So we haven't had huge issues. We certainly, families sign the releases, that single release form. We have very, very little difficulty getting that done because the long run is the rewards for families, what they're getting out of it is so much more. Maurice,
have families been willing to provide the information that you've been asking for your program?
I think initially when we first started, there was a lot of criticism about putting in a lot of the information, a lot because they weren't sure if we would keep it confidential and how we would use it outside. After we've done this in a number of cities and families kind of reassure one another that the information that we share is either cumulative or we ask permission. And so a whole tradition has been kind of established and a certain amount of trust has been established. And so at this point in time, no, we're not getting any problems on that end.
Okay, one more technical question for the three of you, and that is there are many parts of the country where there really isn't ready Internet access. How does this affect, say, going statewide or expanding program? And how are you thinking about it?
So in Indiana, we have talked about this, and there is the state of Indiana, and I assume every state, but I don't know that, has gotten money through the federal government to establish broadband access all over the state. And so Indiana's working with their Department of Information Technology to make sure that the workers have access all over the state for this. So I don't want to speak for every state, but that's what's happening in Indiana.
Okay, Maurice, one of the questioners has written in to say missed the first few minutes of your presentation and would like to know what the overall estimated cost per family it is to support one of your families in the FII initiative.
I think during the first 2 years, now that we're at a larger scale, it's about $500 a year for an entire family, and our family sizes tend to be about 4.6. Like I said, single moms show up in this because actually they're parts of larger families. They don't show up that way to everybody, every program. So it's about $500-something per household per year. they're in our kind of a core status for about 2 years, and then after that they're going to an associate members because the family seems to want to stay, and so the cost is going to go down as we actually scale up.
Okay, and when they stay, that means they keep reporting and they keep moving forward with their network?
Right. The families report on a monthly basis, so we're able to get really micro data on the different trends that are happening, and we can analyze that to see what's working and not working for them, and then be able to look at what program services that are work or don't work. So the monthly basis, yeah, at this point in time, the cost is going to go down, even though we are getting monthly data, and their families are willing to meet with us and be audited in terms of their information at these costs, which is much, much lower than when I provided social services.
I have one more question for you. You mentioned earlier, Maurice, that the really desperate families and most impoverished families are not part of your program, that you're working with families that are poor, but not in quite those dire straits. Are there other ways in which your FII compares and contrasts to conditional cash transfer program?
Well, that wasn't exactly what I described. The fact is that families and extended families and friendships are much broader than we imagine. We imagine either an individual that's gone into crisis or mental health, and we think of them as someone that, you know, is totally separated from family. What we're seeing is more what the Census Bureau indicated, that about a third of the people, which are not entire families, so it would be one of the kids or two of the kids, in my family it was my sister, fall into crisis. And so what we're trying to do is make sure that the entire family and extended family is strong enough so that we get fewer people falling into crisis. So it isn't like all of a sudden an entire household falls into the whole thing. And what we need to do is make sure that what we're doing is strengthening families and strengthening communities so that fewer and fewer people become separated. And like I said, sometimes if we treat it as if it's an entirely different population from the general population, there's 30 million households that are very low income, what we do is we also exacerbate the problem of the breakdown of community in this country.
Okay. And going back to your $500, does that include the computer someone is writing?
No, I don't think that includes the computer initially, but that's a one-time expenditure for us.
Okay.
Also, it's much cheaper. I used to calculate how much we used to pay to try to get the kind of data, and technology now allows us to actually make a computer available, and I get monthly data for, you know, several years. So it's a pretty good investment.
Okay. Kathleen, there's a question from someone suggesting or asking whether there were off-the-shelf or over-the-counter software programs that you could have used, and whether any proprietors are out there in this space creating products for this, or whether you had to create something from scratch.
Yeah. Well, the off-the-shelf providers are, I'm trying to figure out how to explain this. They don't, the data model is different, where it resides is different, and the real-time data exchange is different. And so when I think about what does Web 2.0 mean, I think of real-time data as opposed to batched data, and of sharing of notes. In a typical, in one of these operations, you'd have to download data into a workspace, and then when you're done collaborating around the data, you can, the data gets uploaded back into where it resides. And ours doesn't do that. You can go into it just like we're all on the system, work on something, and then it's recorded and everybody gets it.
Okay. And
we also have a very powerful set of analytics, which I haven't talked about, that are built into the system that give everybody in the state, from the workers, the caseworker, all the way up to the top, access to information like length of stay. You can compare your caseload to another caseload. There are things that are into it that would get updated on a daily basis because it's in real time.
And what kind of general information do you require families to share, Kathleen?
The information, we're building this from the users up. And so the information that is built into our system is what, when we talk about users, we talk about system users at the case manager level, at the supervisor level, at the administrator level, the eligibility people who are in central office, all the way throughout the system. But we actually go through it and build it from the ground up so that it includes everything that, and all the state and federally required data we make sure is in there. The difference is, in our system, it resides under the hood. You don't have to see it. You only have to see what you need to see on a daily basis. A lot of the data that's required by the feds is required for compliance, and it's not really as relevant to everybody's daily needs as some other data. In the screen-based system, you go through the screens in hours. You can just click on what you need.
You mentioned that particularly younger caseworkers, frontline workers, are quite enthused about this because this is the technology that they work with. Are they giving you other feedback in terms of what the impact is on how they handle cases, how they might operate differently when they go out to visit a family?
Mm-hmm. We actually have had some focus groups in Casey Family Services in the different divisions, but we haven't done a survey. It's generally considered best practice to wait until something's been in use for about a year, so we don't have that data yet. We will have it, and in Indiana what we did was do a pre-survey, or we're doing a pre-implementation survey so that we'll be able to measure the pre and post.
Oh, terrific.
So that'll come in the future, yeah.
Terrific. Bruce, a specific question for you. Someone is writing in that in their jurisdiction, the youth justice has very stringent restrictions on privacy around file management and even around letting others know that there is a justice file. And he's wondering if you had similar challenges in bringing youth probation into wraparound Milwaukee, and did they run a parallel system?
Yeah, they have run a parallel system, and they still basically have. You always run into, you never totally replace a system. You're going to still have sort of multiple systems in place. As Kathleen, we deal with child welfare, and they are on SACWIS. And SACWIS is not currently SACWIS in Wisconsin. The state does not let you enter your information directly from wraparound. We can't interface. We can from a technological standpoint, but we can't from the standpoint is that the state does not permit that. However, we can share information with child welfare related specifically to cases that they're doing, not juvenile justice cases, but cases they're involved in through through the secured internet site, because they have the availability of a web-based browser. So same in juvenile court. We're not going to, when we brought juvenile court on, which we're doing, not all of their data is data that we can access. Some of them is to use synthesis to better manage their own systems. Where we can share our kids that we may share, and they have begun now putting the arrest data. We get access to all the arrest data of our kids, and they can have access to the case plans and the progress notes related to our kids. So we're taking small steps. It's not like everything on those, everything gets shared. Everything is all uniformly. This takes a while to do these. We've been working for about the last 16 months with juvenile justice to do it, but they really like this system, and there may be certain things that they adapt that we won't do. So, so it's not like they have access to everything.
The courts have access to your system, is that correct?
The juvenile probation has access to the judges can get access specifically to cases. It's not something they readily do, though. So it's more the probation officer who wants to know what the care plan is for a specific child that is also on probation that's involved in wraparound, because they're all part of the team. So we're doing this collaboratively. So that's the idea, is to share information. You still, we're still careful to share it on need-to-know basis, and not every piece of information needs to be shared. So we're always careful yet, and we're learning a lot, every day. I learned a lot from Kathleen today, and I'm kidding because she was working on my IT. She was talking to my IT person in here, looking at some of the setup and some of the things that we think we could maybe adapt that were really excellent. So it's a work in progress. Everything is revolving.
Kathleen, someone would like to know how Casebook is being funded for use in Indiana. Is this something that Casey is funding? Is Indiana funding it? How is it being funded?
The foundation has paid for the initial build of Casebook and what we're calling the core of Casebook, and then the state is paying for the configuration of Casebook for its use. So it's jointly funded, and we have about a $13.5 million contract that covers the configuration and service and support from 2011 through 2015. 5 years.
Okay. Well,
so it compares. Go ahead.
No, go right ahead.
I was just going to say it compares very favorably to some of the costs that SACWA systems have incurred over the years. It's not cheap. I'm not saying that it's inexpensive. I'm just saying it compares favorably. And we're a nonprofit building this, so that I'm sure adds to it.
Okay. If you were to list, the three of you, the one or two most important lessons you learned about trying to go forward with this innovation, things you maybe wish you had done differently or things that you did and they really worked, what would they be?
I think from our perspective in Milwaukee was to involve the people that are going to use the system, the consumer, which is your families, your care coordinators, case managers, your stakeholders, to involve them from the start in, as you design it, and to make it as, as user-friendly as possible. Having the data, real-time data, having the reports readily accessible to the care coordinators, make the data useful to them, make it easily accessible, make the system very user-friendly.
Maurice or Kathleen?
This is Maurice. Everything that Bruce said, except we would move it down another level to the families, that really what we're striving for is to make data, information, and all these systems more accessible to them. And in many ways, the fact that there's Facebook and there's all of these other mechanisms that are really at the individual and family level allows for us to move this kind of data and information to the level that people can case manage themselves and can help each other, and that really would reduce the costs. And those are the types of things that when we find things that work for our sector, and in particular data and technology, that moving it down to the family level really is one of the most powerful tools that I think we have in this new era.
In terms of empowering families.
Right.
Kathleen.
Yeah. I agree with both Bruce and Maurice. Our vision is that whenever possible, families would be given access and participate. You can control access to these systems, and families can participate and be a part of their own case management. I totally agree with that, and we found I thought child welfare systems would be really reluctant to think about that. We're not doing it yet, but they're not at all. I think that really learning about the difference between waterfall design of technology systems, which is where you get requirements, you design it, then you engineer it, then you test it, and the way that we're building it is in an iterative process, an agile process where the users are involved. We do a release every single week, and the users test it and give us feedback, and we really have involved them very heavily in the design and development of the system. I think there's no substitute for that learning.
We're doing a poll right now. For those of you who are listening, if you haven't voted in this poll, please do. But the question is, what is the greatest barrier to the adoption of new technology in your organization? And nearly 6 in 10 of you are saying high cost, but nearly 3 in 10 of you are saying aversion to change, and another 1 in 10, fear and misunderstanding of technology. So my question for Kathleen, Bruce, and Maurice is, how did you address this concern about change within organizations and fear of technology?
I think that it's a really important issue, and I don't think that technology can be addressed aside from policy and practice, and that I think that if we talk about policy and practice changes that everybody's trying to implement, and we show how technology can support the work, I think that will do as much. It has to be a joint effort of the policy and leadership of an agency with the people who are actually working with the families in the counties, and there's no substitute for that. And also, I think that with older people like myself, I can't do everything that the younger people who are helping us design the system can do. So I think that will change as the demographics of the workforce change.
Mm-hmm.
I think everything, Kathleen, I think everything you're saying is very accurate. I was just going to say, fortunately, it is a younger world and it's changing, but making technology, if the result of technology is making your job easier, that helps a whole lot, even with people that are somewhat reluctant at first, when they can see that what they do is actually easier to get accomplished on a day-to-day basis, and that they have the information they need to better do their jobs. You can get over that. So with training and other support and help, to them.
Maurice?
I was kind of smiling as everybody was answering because I think what everybody's speaking to is there is difficulty in making these changes, but I think they're primarily speaking about professionals that have these kind of jobs. And in our case, it really is low-income families. And I know we work with a lot of families for language is a problem, and technology wasn't available. And what we've found, though, is that it has a lot to do with expectations and then what the trade-off is. And again, it's the same thing. Is there enough in it for them? And for instance, we require monthly reporting online, and which means they have to be able to use the computer, but they also get paid for their time. So we find that, that is a huge piece for them. And then once they start getting information, they find out that actually technology helps them a lot in managing their own life, and like I said, case managing their life. So it really has a lot to do with what the incentives, everybody at this point, because it's getting so large, we can't send checks out, so we're doing wire transfers, which meant that if you, again, wanted to get paid for your time, you had to set up a bank account. So, where before we have all these programs trying to convince people to set up a bank account, all we did is we just said, well, we only wire transfer, and so everybody set up a bank account. They figured out the system. So, again, it has a lot to do with what you're offering, what the family sees as a trade-off.
And what the incentives are for you. I want to thank all three of our panelists today. This has been a remarkably interesting and somewhat provocative conversation. And I think for those of us who are of the generation that remembers when computers were new, the thought of what we're going to be able to do going forward in human services is quite remarkable. So, Maurice, Bruce, and Kathleen, thank you very much. And thank you to the Ash Institute and the Wiener Center.
Thank you very much.
Thank you.
Thank you very much for this opportunity. It's been terrific.